In this lecture, we are going to discuss organelle diseases. And by that I mean diseases that attack and affect certain organelles and how they affect patients. What is an organelle? An organelle is a specialized subunit within a cell that has a specific function, much like an organ does in the body. Individual organelles are usually separately enclosed within their own lipid bilayers. Mitochondria and MELAS syndrome. MELAS stands for mitochondrial encephalopathy, lactic acidosis, and stroke-like episode syndrome. It is a rare form of dementia caused by mutation in the DNA of the mitochondria. As a result of the disturbed function, patients develop brain dysfunction, seizures, and headaches, as well as muscle diseases with a buildup of lactic acid in the blood. Golgi apparatus and eye cell disease. Golgi disorders might result in malfunction of the secretory pathways. Eye cell disease is caused by a failure of the Golgi body to properly phosphorylate and sort proteins, resulting in secretion of some proteins that would otherwise be destined for lysosomes. Patients with eye cell disease present with failure to thrive, skeletal abnormalities, and coarse facial features. Cilia and Carter syndrome. Carter syndrome is a variant of primary ciliary dyskinesia consisting of bronchiectasis, situs inversus, and chronic sinusitis. It is caused by defects in the dining arms of cilia, which make unable to beat properly. This affects the body because embryonic cilia are also affected. Body asymmetry is randomized such that 50% of patients with Carter syndrome will have respiratory and sinusitis symptoms. The dilation of bronchial space leads to the recurrent infections and productive sputum. Bronchiectasis develops over time, and patients are not born with it. Ribosomes and Tracheer-Collins syndrome. Ribosomal dysfunction leads to severe deficits. Tracheer-Collins syndrome presents with mandibular hypoplasia and facial abnormalities, such as cleft palate. Another ribosomopathy is diamond black fan anemia. Presents with macrocytic anemia and skeletal abnormalities. Lysosomes and Pompe disease. Lysosomes are membrane-bound organelles containing hydrolytic enzymes that break down cellular debris. A glucosidase deficiency, a lysosome storage disorder, is one of the causes of Pompe disease. Patients with this condition present with exercise intolerance and develop infantile hypertrophic cardiomyopathy. MELAS is a rare disorder that usually begins in childhood around ages 2 to 15. It mostly affects the nervous system and the muscles. The distinguishing feature is the stroke-like episodes. Hearing loss and fatigue are also symptoms. People with MELAS have an accumulation of lactic acid in the blood, which can lead to vomiting, abdominal pain, fatigue, and muscle weakness, and difficulty breathing. It is caused by mutations in mitochondrial DNA, as previously mentioned. These mutations affecting the genes are inherited from the mother. There is no specific treatment, although certain drugs are prescribed to help prevent and control seizures. Eye cell disease is a rare and progressive metabolic disorder that involves our body's ability to break down certain fats. Symptoms usually begin when patients are infants or early childhood. Symptoms include weak muscle tone, developmental display, limited mobility, club feet, and short hands and fingers. It can also cause a heart valve abnormalities and repeated respiratory infections, which reduces the patient's ability to breathe effectively and typically results in death by early adult years. Treatment is just based off relieving the signs and symptoms in each patient if they can. Carter-Jenner syndrome is an autosomal recessive genetic ciliary disorder. The problem lies in the defective movement of cilia, leading to chest infections, ear, nose, and throat symptoms, and infertility. An early diagnosis is important for the preservation of pulmonary function, quality of life, and life expectancies. In some cases, patients were lucky enough to be able to get pregnant by artificial insemination, but it is not likely all patients with Carter-Jenner's disease will be able to get pregnant. Tracher-Collins syndrome, also known as TCS, is a rare genetic disorder characterized by distinctive abnormalities of the head and face. Craniofacial abnormalities can lead to breathing and eating difficulty. The symptoms of TCS can dramatically vary from one patient to another, even among family members. Some patients can be so mildly affected that they don't even get diagnosed, while others could have life-threatening symptoms. Affected patients present with distinctive facial features and potentially develop vision and hearing problems. The facial abnormalities of TCS are typically symmetric, almost identical on both sides. Mutations of TCOF1 gene cause about 80% of TCS cases. TCOF1 carries instructions that create a protein tracheole. Researchers have found that tracheole plays a role in the creation of ribosomes. Pompe disease is a rare, multisystemic, hereditary disease which is caused by abnormalities and mutations in the GAA gene. GAA is one enzyme that is responsible for the lysosomal degradation of glycogen. A shortage of GAA causes glycogen to accumulate in the lysosomes, which leads to cellular malfunction, cellular damage, tissue damage, and organ dysfunction. Although hardly any symptoms can be present at birth, the disease usually presents itself within the first 3 months, with rapidly progressive muscle weakness, diminished muscle tone, respiratory deficiency, and a heart disease known as hypertrophic cardiomyopathy. As I know there is a lot more information on each of these organelle diseases out there, but I do hope that in this lecture you were able to learn a thing or two about each of these organelle diseases. Thank you so much for listening.